Okay, so we're involved in this project with a number of partners from 3 African countries, from Tanzania, Uganda and South Africa. So the project, our working title for the project is HIV Policy Action. So I suppose that gives an indication that our focus is on not only just HIV/AIDS, but looking at how policy on HIV/AIDS is delivered. So I suppose where our take on this is somewhat unique is that we're focusing on public bodies, public administration system. I suppose we have a strong belief that designing policy is one thing, but how it's delivered can be quite different when it hits the ground. And that's just as true in Ireland as it is in Uganda or South Africa or Tanzania. How civil servants, how officials in health departments, in local clinics, how they deliver policies may be sometimes quite different than what was originally intended. So in the project, I suppose we have a number of PhD students who we are trying to get to look at different aspects of how the public administration system functions in that respect. So we're hoping by the end of the project that we will be able to produce not only publications that are relevant to an academic community, but also publications that are relevant to policymakers, that we would be able to maybe give them a toolkit or give them some directions or some indications as to how they might think about how they engage with citizens, how they engage with people who live with HIV/AIDS, possibly how they might address issues of stigma, how they might cooperate with civil society organisations to deliver better policies. So in a nutshell, I suppose that's really the purpose of the project that we're looking at. Yeah, so the programme that we are operating and supported by the Irish Aid Programme, which is under the Irish Department of Foreign Affairs, is called the Programme for Strategic Cooperation between Institutions of Higher Education, North and South. So that's the big long title of it. I suppose at the core of that is trying to build capacity amongst the higher education institutions. Now, we're very mindful that when we talk about capacity, we're not just talking about capacity of African institutions. We're talking about capacity of UL, we're talking about the capacity of the University of Dar es Salaam, building capacity in the University of KwaZulu-Natal, and building capacity in Makerere University in Uganda. We all have different aspects that we can learn from each other, and I suppose that's a very basic fundamental principle of the project, that idea of shared capacity building. And why it's important, I suppose, is we look at the issue of public leadership in public administration. Many of the people who will work in public administration in all of the countries involved will have done some third level programs, some third level courses. And I suppose what we're trying to do is to ensure that within their training and within their development as students and potentially as civil society workers or public officials, that they are mindful of some of the kind of issues that the project is addressing. So for example, if we do a certain amount of research and focus on the issue of civic engagement, so how the public administration system engages with citizens, I suppose if we can build capacity within the project and within the institutions, that helps people to focus on how you do better civic engagement, well then down the line that creates potential for citizens to have a more meaningful interaction with public officials, rather than just seeing it that politicians design policy, officials implement it, and citizens are at the receiving end of it. We have a different take on it. I suppose that citizens need to be at the very centre of the policy design process. So in terms of capacity building, we're looking at ensuring that universities have the ability to deliver those messages, but then also through the production of short policy briefs and things like a policy toolkit, we're hoping to look at building the capacity of public officials in all of our countries to understand these issues and maybe act on them in a different way. What have we learned from this process? I suppose we're coming towards the end of the project. So we've learned from a number of different aspects of the project. Firstly, we have 4 PhD students, 2 in South Africa, 1 each in Uganda and 1 in Tanzania. And certainly their research is beginning to show, for example in Uganda, that the issue of coordination between civil society and local government and government departments is hugely important. But it's also showing that kind of coordination doesn't always easily happen. There are various reasons for that. Partly it may be that different institutions are not willing to coordinate or not willing to cooperate, or they don't see civil society organisations, for example, as playing a central role. So there may be different reasons for it. In Tanzania, I suppose we're beginning to see that despite the fact that there may be a national policy on dealing with HIV/AIDS, this may be implemented differently in different areas. So we have a student who's looking at a number of rural areas and finding out that for some reason the take-up of messages and education around HIV/AIDS is different in those areas. So she's investigating whether that may be to do with the way that the public bodies have been involved in delivering those messages. Very interestingly, in the South African case, I suppose we're learning that stigma can play a significant role in the design of messages around HIV/AIDS. And I suppose the particular research there is very mindful of trying to ensure that messages don't actually stigmatise people living with HIV/AIDS. In fact, what it should be doing is countering it. But unconsciously, there are various ways that this may happen. So our student there is developing a toolkit to avoid the impact of stigma when policy messages or messages about HIV/AIDS are being delivered. And then our final student in South Africa is researching the link between activists and public policy processes. Student there is a leading member of the Treatment Action Campaign in South Africa, and is looking in depth into the experience of activists, and that's producing some very interesting learning. There's also, I suppose, experiences of research that has been undertaken between the various faculty members who are involved in the project. That's producing quite interesting learning, and I suppose a lot of those projects are just finishing at the moment. I suppose we've also learned, I suppose, that managing a project in 4 countries can be a challenge. Building partnership and deeper partnership and real partnership can be a challenge. But I suppose once we try to establish some kind of an open system of communication, and try to ensure that everybody has strong ownership of the project, well then that's the way we can move forward. We have also, I suppose, identified that there are various options for future collaboration that all of the project partners are quite keen to do. We're looking to develop a joint module that can be delivered in each of the 4 countries, in each of the 4 institutions, and also potentially run a summer school on some of the themes emerging from the project. So I suppose in a fairly short time we've learned a lot. We've learned a lot about our own ability to be involved in this kind of a project, and then crucially we've learned quite a lot about the role of public administration in the delivery of policy on HIV/AIDS.